Good evening, everybody, and welcome to the Arthritis Foundation's webinar, The Role of Diet in Gout Management. My name is Jim Klosowski. I've been living with gout myself for 33 years. So I know many of you are thinking, gout at 2 years old? That was a joke. I was diagnosed in my mid-20s, which is still relatively young to learn that somebody has gouty arthritis. When I was first diagnosed, I had lots of questions like, did I break my toe last night? I had broken my toe playing football in high school, and it felt just like that when I woke up. Went to the doctor and was wondering if this, when I heard the diagnosis, how will this impact my life? I was wondering. I wondered if he could fix it for good, just make this go away forever. What does the disease mean for my health in the long term? And maybe most importantly, will I still be able to enjoy and eat the foods I love? I'm going to say from experience of decades now that mostly yes. Some of the foods that are risky, I can still enjoy in small portions, and kind of monitoring myself for oncoming stiffness the next day, and of course making sure that I'm staying current with my maintenance medication, as I like to call it. While I know firsthand how overwhelming a gout diagnosis can be, I'm here to tell you that you have a lot more power than you might think. There are a lot of things you can do to take control of your gouty condition. And I am proof of that. Besides like the foodie thing, my wife and I both worked in restaurants. We've taught our kids how to cook. We like food. And so besides that, I love walking our dog, running around with our 3 sons, and gout can really impact that adversely if I put myself in a situation where I end up with an attack. This webinar will go a long way towards helping you avoid that. Empowering myself by learning about my disease helped me get where I am today, which is exactly what this next hour, a little over an hour, will help you do. Our expert guests, rheumatologist Brian Mandel from the Cleveland Clinic and registered dietitian nutritionist Ginger Hulton, will guide you through how to manage various aspects of gout, from disease basics to treatments and medications, as well as offer diet tips to help you manage your uric acid levels and improve overall health. So the Arthritis Foundation, with your input, can create more educational tools, resources, and programs that speak to what's important to you. That's why we'd like to share a short video here about our Insights program, so you can make your voice heard and help the foundation create more programs like this one.
By taking part in the Live Yes Insights assessment, you help change lives today, including your own. Change the future of arthritis. It takes just 10 minutes or less to share your experience and make a difference. Answer simple questions like how often you felt arthritis pain in the last week. Ongoing insights data from people like you will lead to new resources that ease daily life. Your insights show what kind of support you need in your community. You improve the healthcare system. You focus researchers and others on top priorities. You'll make more research funding possible, leading to new groundbreaking treatments. The power is in your hands to change things now and for the future. This is your opportunity to change the future of arthritis.
Great, thanks for playing that, y'all. People behind the curtain, please do that survey. Give us some more input so we can make this support even better. Before we get started with the main presentation, we'd like to go through a few housekeeping notes. Tonight's program will be broken down into 2 main parts. First part will be led by rheumatologist and gout expert, Dr. Brian Mandel of the Cleveland Clinic. He'll guide us through the basics of gout, including the different types of treatments and medications that can help manage flares. I think I called them attacks earlier, same thing. He will also help us understand the true role that diet plays in gout disease management. The second part, Ginger Hulton, a registered dietitian, nutritionist, and owner of Champagne Nutrition, will outline the basics of a well-rounded eating plan for gout, including which foods to eat and which to avoid, and tips for affordable and easy meal prep. We've muted all attendees for this event, but you can put any questions you might have throughout the presentation in the Q&A box on the bottom of your screen. We'll try our best to answer as many questions as possible after each presenter. After tonight's session, you will receive an email about your experience. Please do this survey. They help us track the success of the sessions and to better plan for future events. So without further ado, let's get started by introducing our first speaker, Dr. Brian Mandel. Dr. Brian is chairman of academic medicine and senior staff physician in rheumatology and immunologic diseases at the Center for Vasculitis Care and Research at Cleveland Clinic. He's board certified in internal medicine and rheumatology and is currently the editor-in-chief of the Cleveland Clinic Journal of Medicine. Dr. Mandel is also a professor of medicine at the Cleveland Clinic Lerner College of Medicine at Case Western, and a graduate of the Stanford Faculty Development Program in Clinical Teaching. He has served on a national education planning and writing committees for the American College of Rheumatology, the American Board of Internal Medicine, and the American College of Physicians. Dr. Mandel has chaired the national meeting planning committees for the ACR and ACP and was the vice chair of the Internal Medicine Resident Review Committee for the Accreditation Council for Graduate Medical Education. Dr. Mandel, welcome. Thanks for joining us today.
All right, so gout basics and triggers is kind of my charge for this afternoon, which I should tell you is a lovely summer afternoon in Cleveland. What we have when we're talking about gout basics is the first and the summary is that gout comes from abnormal deposits of uric acid. And those deposits come from too much uric acid in the blood. And if we take away those high levels in the blood, we will take away the abnormal deposits and we will take away the gout. Gout is a totally curable disease. And I think if you take away nothing else from my discussion here today, that should be it. This is not a death knell or a lifestyle knell. This is a treatable disease. So let's talk about the basics of this. So uric acid, it's a common chemical. It's created when the body breaks down substances from DNA and RNA, breaks it down from purines. That's the building block. Purines are produced by all of our bodies. It's also found in some foods and drinks, and it's normally dissolved in the blood and eliminated mainly through the urine and some through the GI tract. And in people with gout, the body does not efficiently get rid of enough of the uric acid, and thus too much of the uric acid builds up in the blood, which then settles in deposits in and around joints. This is very easily pictured for those of you who drink iced tea, or in the South, sweet tea. You put too much sugar in a glass of iced tea, and ultimately it's going to settle in the bottom of the glass. You put too much uric acid in someone's blood, it's going to settle in and around the joint structures of the body. Those deposits can break down and release crystals of uric acid, and when they're released, they cause flares in the disease, which those of you with gout are very well and too well familiar with. So your genes are the main factors that determine how well your body eliminates the uric acid. So gout is really a genetic disease, and it does tend to run in families. But there are other factors that affect the uric acid levels in our blood, including certain conditions that travel with gout, being overweight, having diabetes, particularly if you have too much insulin, type 2 diabetes, poor kidney function because you can't get rid of the uric acid, sleep apnea, psoriasis, and a number of other conditions. Drinking too much alcohol or high fructose, like mainly corn syrup drinks, And high fructose is particularly bad, it turns out. These can contribute to high levels of urate in our bodies. There are certain medicines, transplant medicines like cyclosporin, water pills or diuretics, which we use to treat congestive heart failure or high blood pressure, can raise the urate level. Purine-rich foods, liver, anchovies, sardines, meats, beer, including non-alcoholic beers, all contribute to elevations in the serum urate. But it's critically important to realize that most of the uric acid level in our bodies, most of the uric acid level in our bloodstream, most of the uric acid level in those deposits, that comes from within us. It's not from the diet. It's not the diet that is the main contributor to most patients who have gout. Menopause also leads to slight increased urate. Now, I mentioned the medications, but don't get the idea that you should just stop those medicines or we shouldn't use them in patients who have gout. We need to. These are generally necessary medications, and we need to work around them. And that's something that you do with your physician. Occasionally, they can be switched to something else, but medications are not the primary issue, and generally, we can deal with that relatively easily. So what causes those flares in gout that everybody knows to just love? Well, sudden changes in the blood uric acid level, surgery, alcohol ingestion, particularly that college fraternity type of binge and fast and then eat. But usually the trigger for an individual flare is not known. We do know that if you suddenly stop taking your uric acid lowering medicine, that's an excellent way to trigger a flare to happen. Don't do that. So a flare is characterized by the sudden onset of joint pain. It usually comes extremely quickly on. Sometimes it'll inch up. Some patients will have twinges they'll feel, but generally it comes on fast and is severe within the first 12 hours. Early on, the attacks often in the big toe or the foot with swelling, heat. It actually generates heat and redness, extremely tender to touch. The pain may last a few days to a few weeks, but over time, I'm talking months to years, usually years, if we don't treat it, more joints are affected. The disease tends to last longer and involves more joints. And until the uric acid levels, deposits are gone, flares can still happen. And those deposits take a while to dissolve. So even if you're on appropriate urate lowering therapy and your blood level is low, until those deposits dissolve, you can still have flares in the gout. So just because your blood level has come down, it doesn't mean that you're totally cured yet until the deposits go away. That takes time. So you do need to have a little bit of patience. Now, some folks go a long time without ever having a flare. Others have attacks or flares every year. Rarely people will even have a flare every month if it's particularly bad. And if the uric acid level in the blood is not lowered, those deposits, like the bottom of the iced tea glass, those deposits will settle, sometimes even under the skin or around joints. We call those tophi. A single one is a tophus. And this is the uric acid level building up in an area that we actually can see or feel. May not be tender, it may be soft, it may be rock hard. But the gout may affect fingers and hands and feet, elbows, Achilles tendons, many places throughout the body. Here are the hands of a patient of mine, and you can see these pimply white chalky deposits all throughout his hands. They were involving his tendons. He couldn't make a fist because they were stopping it. Here's another patient of mine, and you can see massive deposits in and around the joints. And to emphasize, this is a curable disease. Treatment works. This is 9 months after very aggressive treatment in lowering the uric acid. Same set of hands, obviously strikingly different. This is a curable disease. So let's talk about medications a little bit here, and understanding how the body metabolizes, it gets rid of uric acid, and the role of diet. Just as an introduction here, you'll hear much more about diet right after my talk. So diet matters, but it's not the major treatment option for gout. It is very important, however, for gout-related diseases, including diabetes, heart disease, kidney disease. So I'm not minimizing the importance of a heart-healthy, common sense diet, but I'm just saying that diet alone is not going to cure your disease, and therefore you're not totally for blame if you're not cured yet because you're eating wrong. No, you need help. This is a team sport with your physician. So you need to follow the medication regimen as prescribed. Supplements, cherry juice and things, this may help a little bit, but not nearly as much as the targeted, very effective medications that we have available to us now. And in using the medications, we go for this minimum target of a urate level in the blood of 6 or less. We do that because if we keep the level at 6, we will dissolve those deposits. Instead of going from the blood settling into the joints, if we lower the blood uric acid level, the deposits will dissolve into the blood and go away. The same way we can dissolve the sugar in that iced tea by adding more or diluting the sugar content there. What do we do? How do we manage it? We're going to check the levels of the uric acid level as we're adjusting the medication and until we reach that target. For some people, the target may be 4, it may be 3, because the lower we get the blood level, the faster we can get the deposits to disappear. Once we're at the target, we monitor the blood urate level approximately every 6 to 12 months. Healthy habits, self-care, these clearly matter to your overall health, physical activity, weight management. Weight loss is another great way to lower the serum urate level. So in terms of medications, you may not need a rheumatologist, but we like to think that we have something to add here based on our experience in managing gout. Internists, family medicine doctors can also obviously do this as well. What we found when we survey practice habits across the United States and the world, rheumatologists tend to do this pretty well. So in managing a gout attack, a gout flare, we use non-steroidal drugs such as the prescription dosing of Aleve, sometimes Advil. Advil only lasts for about 4 hours, so we tend to use longer acting drugs. Steroids either given by mouth, oral steroids, sometimes injected into an arm or the butt, sometimes injected into a joint. If it's only one joint, we'll inject cortisone into a joint. And colchicine we will use to sometimes treat attacks, more often to prevent attacks. But mainly the treatment for the disease is to lower the blood uric acid levels. The disease is the high level of urate, the high level of deposits. The flares, the attacks, those are symptoms. That's not the disease. It gets your attention, gets my attention. But the disease is the high level. And these are some of the medicines we'll use to lower the blood level: allopurinol, febuxostat, probenecid, and pegloticase. And I show you again the hands on the left there, and then the same hands on the right after keeping the level down for many months. You can see, again, this is a treatable and curable disease by paying attention to the appropriate approach. If you get a flare, if you get an attack, you can take an over-the-counter pain med such as Aleve in a higher than the over-the-counter dose. But generally, in working with your physician, we'll have a plan with you. So you basically have a prescription of the appropriate dose and a plan of when and how to take it. We call this a pill-in-the-pocket approach. I tell patients with gout, you don't leave home without it. You certainly don't travel without your medications in case you get an attack. Ice the area will help a little bit. Keeping it elevated may help a bit, but mainly ice, but mainly the medication. You want to avoid alcohol, no matter how bad that pain is. A couple of scotches are really not going to be helpful for that. And avoid kind of, the lobster and steak dinner to celebrate when it starts to feel a little bit better. And mainly, if you get in a flare, to continue all of your regular medications. Do not stop those medications if you get a flare. The best way to manage this in working with your doctor is to keep track of your flares and your medication. Helps you pay attention to your body, understand what symptoms, what specific foods may make a flare happen. People are different in this way, but keeping track of this is very useful to know and to talk to your physician about. So I will end my brief tour of Gout 101 there and be very happy to answer questions as they come in here. I think I can see on here some of the questions that are coming in from the chat function. I can start and just scroll through and answer some of these as they come in. And I think you could ask more as we go along. So first, if I have a knee replacement, would gout still attack my knee? So you would think that the bones and the joints are all ripped out and no gout can happen. Unfortunately, they still can happen because there are remnants of the lining of the joint. The synovium still may be there, and those may still have deposits within them. So you can still get flares of gout in an artificial joint, which is a surprise to many people and actually often a surprise to some doctors. Can gout affect the whole body? I have stiffness and pain everywhere. No, not the whole body. Whole body has been reported in very odd places. I've seen deposits in the cornea, but not a flare. But generally, there are going to be flares in the joints, in tendons, and in bursa, the sacs around certain areas like the elbow and over the knee. But generally, joints and tendons are the main target. Are people with other forms of inflammatory arthritis likely to get gout? Or does gout make it more likely to develop another type of inflammatory arthritis? No. The answer to the second question is no, gout is gout. You can have gout and also what's called pseudogout, which is instead of uric acid crystals, calcium crystals. So you can get both of those. But one type doesn't necessarily predispose to another, although folks with osteoarthritis seem to be a little bit more likely to develop gout, but that could be because of age as well. Once I'm below a level of 6, can I lower the amount of medication I need? Probably not. You probably want, it depends how low you are, but you probably want to keep that level well below 6 for quite a while. And the reason is it takes a while for those deposits to go away. Remember, I said you can lower the level in the blood, but you still can have flares as long as there are deposits in and around joints. So you want to keep that level nice and low, really for many months, maybe a couple of years before thinking lowering the dose of the medication. And you never want to lower the dose of the medication to let the level of urate go back up much above 6, because what happens is that maybe you've gotten rid of all the deposits. But then if you lower the medicine and you let your blood level go up again, the deposits start to form again. And lo and behold, after months or a year, you're going to start to have gout attacks again. So you want to be very attentive to keeping that level low. This is a great question. There are concerns over the risk of serious heart-related problems and stroke caused by febuxostat. Should I be worried? The simple answer to that, based on the data that have come through, is no. You probably do not need to be worried about febuxostat per se, or worried about lowering the urate level per se. There was a study that came out that suggested there may be a risk in febuxostat. The FDA put a warning on the drug because this was a safety signal, but there were some very confusing parts of that study. It was not straightforward. And then since that time, there have been several studies that did not reproduce the findings of that. Science is a very fluid environment. As we get new information, as all of you should be aware from watching the news with COVID, as we get more information, you have to change and update your perspective. So while there was a concern with febuxostat based on that one trial, other information comes across and it tells us, no, we really do not need to be worried about it. How does allopurinol compare to febuxostat in terms of side effects and efficacy? They will both work equally well in most people. You just have to raise the dose to get to the target level. 40 milligrams of febuxostat is about the same as 300 milligrams of allopurinol. But that doesn't mean that febuxostat is a better drug for everybody. It just depends on the dose of medication that you use. Serious allergic reactions can happen. They're more likely to happen with allopurinol and happen very early, but really with certain subsets of population based on the genes that people have. Southeast Asians, particularly the Han Chinese, are more at risk for this unusual rare side effect of an allergic reaction than others are. So we're attuned to that, and we may pick one drug versus another based on that. Other side effects are very similar between the febuxostat and allopurinol. One thing up until recently, which is changing a little bit, is the heart attack you can get from the bill that you get from your pharmacy for febuxostat, which was very expensive for a while. The cost of that does seem to be coming down a little bit. Question is, I had a uric acid test done because of my second toe swelling and red for the past 6 months. The result came back at 5.6. Since I'm below 6, can that number be reversed without medication? I don't know what you mean to be reversed, but the first thing that I should say is we don't diagnose gout based on the blood level. The best and the reliable way of diagnosing gout is to look at the joint and actually take the fluid from the swollen joint and seeing that there are urate crystals in the joint. That's the way we make the diagnosis. People can have high levels of uric acid in their blood and never have attacks of gout. You could have a high level of uric acid in your blood, but have an infection in your joint, in your ankle, in your toe, in your knee. And if you just look at the blood, you'll say, oh, I have gout because my level is high. No, you could still have an infection there. So the level per se is not diagnostic. Now, at times of an attack, it turns out that sometimes the level of uric acid measured in the blood is lower than what it normally is. So if you have a swollen toe and it's an attack of gout and your level is 5.6, it still could be gout. And if you check the level in your blood again, several weeks later, it could be 6.6, could be 7.2. So we don't use the blood level for that decision. Can you reverse the uric acid level just by other means other than medication? Occasionally with diet, and you'll hear more about that. But most people, no. Most people, to really get that level down low, you're going to need medication. Next question and last question I'm told here is, I am 69. I have acute attacks 3 or 4 a month. What can I do? You need to see and talk to a doctor because, again, the bottom line here, this is a curable disease. To have 3 or 4 attacks a month, if they actually are all gout flares, you need to be on medication to, first of all, treat the flares, be on medication to stop those flares from happening from using anti-inflammatory medications. And then once you have those medications, which may be low doses of colchicine, then you get on medication to lower the uric acid level. And months from now, because if you're having that many gout flares in a month, it's going to take many months for those flares to stop. But I will almost guarantee you that if those are all gout flares, they will stop with appropriate lowering of the uric acid and an approach to keep the inflammatory response from happening. So I am told here that that is the last question that I could answer because of time. But if you send in emails to with information, I'm happy to try to answer other questions later offline if we can do it. I hope you all have a good night, and I'm looking forward to hearing the next discussion about diet as well.
We had one more for you, Doc. If you were diagnosed with a rare type of RA and OA, is there a possibility you can acquire gout with the presence of multiple joint deformity in hands, elbows, feet, and wrists?
So I would say that there is a separate issue. I don't know what a rare type of RA or OA is, but let me answer the question slightly differently. If you have rheumatoid arthritis or a type of arthritis that has damaged joints, it is not necessarily that you're more likely to develop gout in those joints. The issue will be much more related to what is your uric acid level in your blood. And if that is very high, then you're more likely to develop gout. It may not be in the same joints, but what we do know is that you can have gout or say psoriatic arthritis, be on medications that are anti-inflammatories and control the rheumatoid or control the psoriatic disease, but those medications may not control the gout. So you can have controlled rheumatoid disease, but then have attacks of another type of arthritis on top of that.
Great, thank you. If any attendees have further questions for Dr. Mandel, you can send them to an email I'm going to read off right now, and someone from the foundation will convey the questions and hopefully get back to you soon. Email is mandwele@arthritis.org. Again, that's mandwele@arthritis.org. Thanks, Dr. Mandel, for taking the time to answer those questions. And thanks so much for lending your time and expertise tonight. I saw most of those slides at another Arthritis Foundation webinar we did together in the past, and they're still helpful in understanding my condition. I mean, I think the thing that really stuck with me this time that didn't last time, or you conveyed it in a different way, or my ears were open, was that the disease is a higher level and the attacks are a symptom of that. That's a really good way for me to think about that. So thanks again. I believe I can speak on behalf of our audience that we are now more empowered to take control of our condition. Now that we know the true role of diet in gout management, let's turn it over, or to get a better sense of the true role, let's turn it over to our second guest speaker, Ginger Halton, for some diet nutrition tips. Ginger Halton has a master's degree in nutrition and is a registered dietitian nutritionist. She specializes in plant-based diets, integrative nutrition, oncology nutrition, supplements, lowering inflammation through food, and nutrigenomics. She also owns the Seattle-based concierge nutrition practice, Champagne Nutrition, Champagne Nutrition, and Seattle Cancer Nutritionist, where she helps clients optimize their health with an integrative approach. Ginger currently serves as adjunct clinical faculty at Master Center for Natural Health, teaching master's level nutrition students. She's also the author of Anti-Inflammatory Diet Meal Prep, 6 weekly plans, and 80+ recipes to simplify your healing, which takes the guesswork out of eating a healthy meal with a healthy diet with simple meal plans for any budget. Ginger, welcome, and thanks a lot for joining us tonight.
Thanks for having me. I'm really excited to talk about this. I have a lot of passion around this subject, and I help a lot of people that have gout. And I really appreciate going after Dr. Mandel because as a registered dietitian, I do talk about food and hydration and how that plays a role in gout. But also it's important that people are working with their doctors and getting the medical treatment that does make the bigger part of the difference. But I do find that when you're dealing with something like gout and you're having attacks, especially like some of the questions we heard, many attacks, it can feel a little bit out of control. And so I think people come to nutrition to find something that they can do and to become empowered for their health. But the really good news is that the kind of things we're going to talk about today, it's not just for gout, it's actually for kidney health, it's for heart health. And so there's a lot of benefits of changing your diet. It can help your gout, but it could also help other parts of your health. So just to get a lay of the land, the first thing I wanted to do is to talk about some of the major things that you should eat and some major things that you should limit. And notice that I say limit, not eliminate. And the reason for that is gout is different for all sorts of different folks. And the number one thing you'll hear when you're talking about gout and diet is don't eat this, don't eat that, stop eating this. But actually, I really want you to notice on this slide, the bigger list is the do eat. And so I really want to empower all of you to think about what you can add in that's going to make the difference. So let's talk a little bit about the do eat category. Kind of boring, but really important. The first thing is water. So if you have gout, especially if you're in a flare, but actually all the time, because this can help prevent flares in a dietary way, staying hydrated is really, really important. So that's actually one of the dietary foundations that you can do for a gout condition. On the other hand, as far as beverages, it's just a pure fact that all alcohol, actually, especially beer, can be a really big problem. And the research says very strongly, especially with heavy drinking, that is usually 3 or more drinks a day, that can really, really add up and make gout flares much worse and happen more often. So that's really kind of a big, like, let's talk about how this fits into your life. Other than that, there's a few dietary patterns that can really make a difference for you. And it's important to think about dietary patterns. When I say that, I mean like the Mediterranean diet, a plant-based diet, vegetarian and vegan fit in there. DASH, which is dietary approaches to stop hypertension. It's got a long name, you can just call it DASH. All of those overall dietary patterns, that means foods you eat day in and day out, those actually show up in the research for gout to make a difference, right? So if you're looking for like, how do I eat? Those are some nice structured evidence-based plans that do have some interesting research around them. So I did write a little bit on this slide just so you can see, well, what does a Mediterranean diet mean? Because that one just shows up again and again for heart health, diabetes, gout. What that really is focused on is, it's actually a plant-based diet focused on fruits, vegetables, whole grains, and legumes. Those are all low in purines, right? So that's a great foundation for a gout diet. There's a moderate intake of like fish and poultry, maybe a little bit, very little red meat, a lot of use of like healthy fats like olive oil, and really light intake of red meat or full fat dairy. So that's an example of the types of foods overall. And notice I'm talking about dietary patterns, not just single foods. We really start to we need to think more big picture, right? Every day, all day, you're eating foods. What does that pattern look like for you? As far as the foods to move away from, we hear a lot about red meat and organ meats. So like liver, kidney, gizzards, heart, those kind of foods are among the highest in purines. So, moving away from those organ meats, but also red meat in general can be really helpful. And then also there's some seafood that's really high in purine. A lot of seafood actually does rate relatively high, but things like shrimp and lobster are on the higher end of the spectrum. So those foods and alcohol are most commonly talked about. But one thing I don't think we talk about enough is actually added sugar. And Dr. Mendel spoke about this a little bit. It's really, really important. Soft drinks like colas, sugar sweetened beverages, that added sugar and high fructose corn syrup, that is an issue. And that falls into the category of like a high refined carbohydrate diet. So it's not like don't eat whole grains, it's more don't eat a lot of added sugars, because that can be a problem. And so I think we should be talking a little bit more about that. So this is more the do eat and the limit. It's really important to start to think a little bit bigger picture. But let's talk on the next slide about some gout myths. And I want to take these one by one. So the first one is detoxes and restrictive diets. And Dr. Mendel said something that I thought was really interesting. He said, some people will like go on a strict gout diet or what have you, get their numbers down, and then go out and have like a steak and wine dinner. And that's really interesting to me because I see that so often. People, when they're doing detoxes or restrictive diets, it's not sustainable. So then you're on this roller coaster going up and down. And like Dr. Mendel said, that can be one of the worst things you can do. So it really is important to look at the everyday, all day dietary pattern that you're following. How can you help your health in general? And how can you help manage gout flares in a stable way? So for that reason alone, I would really recommend not doing detoxes or restrictive diets. Like you saw on the last slide, it's more about what you add in versus what you take out. So let's talk about the next point. This one's really, really important. I hear a lot of people that say, oh, can't eat tomatoes, can't eat coffee, can't eat citrus because it has acid, and I don't want high uric acid. But it's important to understand that acidic foods are not the same as uric acid. So it's actually purines, like Dr. Mendel was talking about, those compounds that are in red meat and seafood and beer and alcohol, those are the bigger problem. And so you don't need to eliminate tomatoes. Actually, tomatoes could be helpful. Those kind of fruits and vegetables should be part of your dietary pattern. So no need to worry about acidic foods. The next one you probably have the most questions about. I'm excited about this myth. You've probably heard this one before. I know it's queuing up in just a moment here, but like I said before, It's not about the single foods. But when you're hearing about gout, or when people are talking about it, or if you're poking around online, you see a lot of chatter about eat this or eat this, it'll get rid of your gout attack. But it really doesn't work like that. Like we just learned in the medical portion, it's more about lowering the levels in the body and helping, your body get rid of it instead of having it build up in your joints. So if you think about it that way, it doesn't make sense that I could just eat some cherries and my gout's naturally gone, right? It's more of a physical process that's happening in the whole body. However, there are some foods that seem to either reduce the incidence of gout or be slightly preventative, or maybe even help bring uric acid levels down a little bit. We learned in the last portion that diet is only a part of treating gout, right? It's just a little piece of it, but it is something that's in your control, and it is important. So if you're getting the right medical care, I think it makes sense to think about, how can I increase my fruits and vegetables? Cherries have some really interesting research. Cherry juice, specifically tart cherry juice, black cherry juice, that has some interesting research, right? But I just want to make sure that you know that you can't just drink cherry juice and then your gout is gone. I wish it worked that way. It doesn't. But I like to take cherry juice, no sugar added, right? Because we talked about how sugar isn't helpful. Dilute it with some water so I get more hydration. And that can be a really nice way to get some extra antioxidants. You could also just eat cherries. That's a healthy food anyhow. There's something probably having to do with the antioxidants in there that could be helpful. Coffee shows up in some studies as potentially beneficial. Again, very unique antioxidants. I always say, as a registered dietitian, coffee is a health food. It shows up pretty positively in a lot of different research. And then soy, actually, too. Soy shows up again and again as a positive in some of these overall dietary patterns. So none of these foods, when eaten alone, are going to cure a gout flare. But if you include them over time, they could be helpful. Let's talk about the next one. Consuming dairy causes gout. This one's interesting because actually it's pretty much the opposite. Eating low-fat dairy seems to be helpful for gout. High-fat dairy, there's some mixed research on it. So I would move away from high-fat dairy with sugar added, like the ice creams of the world and the sour creams and cream cheeses and butters, and move more to like low-fat yogurt, reduced fat milk, and maybe some hard cheeses or lower fat cheeses. These could be beneficial, actually. So don't fear dairy for sure. And finally, I think everyone is realizing this by now. Gout cannot be cured by diet alone. It might move the needle a little bit, especially if you're taking that big picture, long-term approach, but it's really not going to be like, I eat cherries, my gout's gone. Again, I wish it was, but it's not as powerful as some of the medications and other practices that you'll do that are more lifestyle related. So diet puts things into perspective and helps with the medication, and they work together. All right. Really important, just like eating cherries or eating coffee, drinking coffee or eating soy isn't going to cure gout, high purine foods aren't necessarily going to cause gout like right now. I think it's important to know it's not like I drink a beer, I get a gout flare. Some people are more sensitive than others. Some people are walking around with higher purine levels than others. So it's really hard for any of us to say you can have exactly this much, but not this much, because it depends on the person. So over time, it might be helpful to keep a food log so you can really start to realize and see if there's any connections for you. But interestingly, there's some plant-based purine-rich foods like broccoli, like soy. These are plant-based foods that do contain purines, but those are not linked to increase in gout like beer or red meat is. So don't fear the plant-based foods. They actually could be beneficial for you. Let's move on to the next slide. I have a couple books out. You heard about that. One is about the anti-inflammatory benefits of food. And so I love talking about how to lower inflammation in the body when you have that pain, swelling, red, irritation. That's what inflammation looks like. And so we want to calm that down by looking at certain foods that can be really soothing to the body. These fit into a plant-based Mediterranean and DASH style diet. Whole grains, beans and lentils, including soy, those should really be the baseline for what you're eating. High fiber, lots of vitamins, minerals, and antioxidants. Citrus, fruits, berries, including cherries, those are all really, really helpful. And and most of us should be eating more of those. And then every single veggie, every single one is absolutely important and very helpful on a dietary pattern for gout. And also, like I mentioned, good for kidneys, good for heart, good for blood sugar levels too. Nuts and seeds are an awesome heart healthy, high protein rich food. Cocoa, herbs, and spices. When I'm really working with people on trying to lower inflammation levels, these are some of the foods that I'll really help them step into and learn how to incorporate into their diet. I have a recipe today that I'm going to show you how to do that. So it's easier than you might think. Plant-based foods, keep in mind, you don't have to be a strict vegan. You don't even have to be vegetarian, but eating more plant foods gives you more antioxidants and more fiber for gut health and for calming the body down. And if you're experiencing gout flares, that's probably really relevant to you. Let's go to the next slide. I did want to also talk about just some simple swaps. I'm going to show you a plant-based burger today. And before you get mad at me for trying to sell you a plant-based burger, I just wanted to point out that if there's foods that you love, there might be an alternative that is actually pretty good. Am I going to tell you that a bean burger is the same as a hamburger? No way. And so I don't want you to go into it expecting that. I think that's where a lot of people go awry, is like, this doesn't taste the same. It's not necessarily supposed to, because it really can't. It's a different product, but it still could be good in its own way. And that's what I want to talk about. So instead of a regular burger, I really love bean burgers. They're strangely good, especially if you season them right. It's not like eating a bean. It's like eating a burger in its own way. So I'm going to show you that today, but it really, really can be great. And there's some very cool burger substitutes out there now that I think are worth a try for you. Beer, even non-alcoholic beer, I'm sorry, I wish there was a better swap, but it doesn't mean you only have to drink water. I mean, you could get creative with things like kombucha, which is a fermented tea, or a shrub. I live up here in Seattle and shrubs are everywhere. It's like a vinegar-based little drink that you put with sparkling water. So, you know, you're not just stuck with plain water and you can't do anything else. I think you could get creative and just say, well, I can't really do beer, or alcohol really puts me into a flare. I'm going to go in a different direction, but I'm still going to enjoy myself. So positively framing it. Meat-based broths and gravy, those can be really high in purines. And so I have a client that she didn't realize that. And I just said, can you do a plant-based, you know, like a veggie broth? And she said, oh, I have the mushroom broth that tastes the same. It's delicious. I love it. It's been a huge win for her. That's a simple swap that tastes basically the same. And then if you're into drinking cola or soda, it really might be time to look at reducing or eliminating that and moving more to sparkling water or something else, because until you get off that cycle, it really might be a problem for your gout. Let's try the next slide. Talked a little bit about this before, but I just wanted to give you the heavy hitters one more time. The red meat, especially organ meats, colas and added sugar. Don't forget that one. It's really, really important. And alcohol, especially at high levels, but it's really important to start to understand what's triggering for you. It could be just a little bit, or you might be able to tolerate more. It's hard to give a blanket recommendation to everybody. Next slide, please. If you're feeling overwhelmed, or you're like, I don't want to be plant-based, it's totally fine. There are steps you can take that will actually add up to be big changes for you. Focus on foods that you enjoy and that you're familiar with. So don't just flip it upside down and start eating only salads, right? If that's not what you're used to, instead of a burger, make a bean burger. I'm going to show you how to do it today. Go slow and take it one step at a time. It could also be really helpful to reach out to an expert, a registered dietitian like myself, who can help you personalize what this looks like. Start by increasing plant-based foods. Reframe it to like, not what I can't have, but what I'm trying to add more in of. And I'm trying new foods, and that's a positive for me and my family. Ask for support from the people around you. And I think it's important to just weave in really simple swaps. Maybe it's not even cutting out meat. Maybe it's just adding some mushrooms in, or adding some beans in. That could be a good fit. You do have to have one thing in order to do this. You have to have an open mind. If you go in and you're like, I'm going to hate this and it's going to taste bad, it probably will. So having a positive attitude and saying, I'm going to do this for my health, and I'm going to do this with my friends or family, that can make a huge difference and just make the changes a lot more positive. All right. I think I've got one more slide, then we're going to make a quick burger. I wanted to point out too, you can do all of this on a budget. Like even the Mediterranean diet or a DASH diet, it doesn't have to be super specialty, fancy superfoods all over the place. As long as you plan ahead, you make your grocery lists, you get creative, shop in bulk, utilize frozen and canned foods. Those can actually be really nutritious and more affordable options. Eating beans is often a lot cheaper than eating meat and seafood. So you might naturally save money that way. And then it's really important to be prepping your meals and thinking ahead, cooking in batches, making leftovers. Even just by doing that, you're really going to save yourself going out for lunch or things like that, because you're going to be more prepared, and you can actually save a lot of money by doing that. One of my clients recently, she was going out for coffee almost every day. We started having her make coffee at home and make a little breakfast at home. She started saving tens of dollars a week. It was really awesome. So there's just so much that you can do by getting a little creative and planning ahead to set yourself up for success. All right, it's burger time. I'm really excited. I made these ahead for you all, but I wanted to show you how to shape them and talk you through it a little bit. Let me grab it from my fridge. So it's right here. And then I'm going to show you my kitchen a little bit more. I already put all the ingredients in a food processor. This takes like 5 minutes. So okay, yeah, I'll show you. We can also pop back to the last slide when we're finished. And I'm going to get rid of my sun glare. All right, there we go. Really quickly, what this is 1 can of black beans, 1 can of chickpeas, a half a yellow onion, 3 garlic cloves, 2 eggs, a whole teaspoon of cumin, which makes it taste really, really good, a little bit of salt and pepper, 3/4 teaspoon each. You can cut it down if you want. A cup of breadcrumbs, whole wheat would be ideal. A half cup of oats, really great high fiber whole grain. And really that's it. So I just ground that up. And if that stressed you out because it was so fast, don't worry, because we're going to share the link with you. And I just put up a new blog post so you could have it. So that's over on the Champagne Nutrition blog. So this is what my batter looks like. It kind of just looks like burger batter. It smells delicious, and it's literally just mashed up beans. But when you do it this way, if your hands are hurting, it's completely hands off. You just put everything in and pulse it, then you're done. So what I'm going to do, and I'm literally going to have this for dinner tonight, so thank you for helping me prep my dinner. I'm going to use mini buns, and I want to show those to you. And that could be really fun if you have kids in the family, because, you know, mini food is really much more fun to eat. So as you can see, it really just shapes kind of like a burger, and it looks kind of like a burger, right? So we don't want to do something completely different and foreign. We want to do something familiar. I'm going to make it kind of small, like the palm of my hand. And then what I'm going to do is I'm just going to place the burgers on my silicone liner like this, and I'm going to bake them or grill them. These are my mini buns. They're super cute. They're little pretzel buns. Whole grain, like whole wheat, would be a little bit more nutritious, but this is what I've got today, so I'm not going to stress it. I'm going to cut these open and stick them on the grill and make them toasty, right? Just like a normal bun. So you want to make this food as normal as you possibly can, because it is, right? And it tastes really good. I think it's also important to make sure that foods that you're trying that are new are they're really tasty. So if you like barbecue sauce, use barbecue sauce. If you like mustard and ketchup, use mustard and ketchup. If you want to put a little cheese on there, it makes it taste better. Do that, right? I think you just need to get a little bit creative, but I have some anti-inflammatory toppings that I wanted to walk through with you before we go to Q&A. So I made 2 burgers, super cute. You can't even really tell that there are beans in there. And if you want other bean recipes that trick people, I have the best black bean brownies. That's up on my Champagne Nutrition blog too. And don't tell anyone there's beans in there, and they'll never know. So what I'm going to do as I make my burgers, I just wanted to show you some of my anti-inflammatory toppings. I have a beautiful head of romaine. Like I said, most of us are trying to eat more fruits and veggies. This adds a nice texture, so it's really crisp and fresh. You could also do a side salad, but I'm just going to cut these right in half, put them on the burger bun so you have that beautiful lettuce sticking out. I have my mustard and ketchup here because, again, you don't need to go without these things. Like, it makes a burger more like a burger, so feel free to do that. Tomatoes are really perfect on a burger. This is a beautiful tomato that I'm just going to slice up. Everybody has a burger, even like on the fast food burger, tomato on the fast food burgers, you have tomatoes. So I'm just going to do a thick slice and put it on. These are really anti-inflammatory, very unique antioxidants and some fiber in here. But the most exciting thing I wanted to show you is my beautiful avocado. I've been slicing it a little bit. This is a really heart healthy fat. It's high in fiber and it's really creamy and delicious. So just because you're eating beans doesn't mean it needs to be boring or not taste delicious. So I'm gonna get some layers, like make like a little fan with my avocado in thin slices and just smother it all over that bean burger. So the bean burger is really like savory, delicious, and I really look forward to eating it. It's not like, oh, a bean burger. It's like, oh, a bean burger. So that's how you do gout swaps, right? So that you are excited about the food you're eating and it tastes good. This is a really good recipe. So even if you're like a little skeptical, I'd love for you to try it and then leave me a message and let me know how it went, because I'm guessing that you and your family might be really into it. And it could be a new food that's very easy for you to make, even if you're living with some pain or you're in a flare. This is possible to make. So with that being said, I want to do some questions.
Hey, thanks, Ginger, for that great presentation. I know our audience has questions. They came in through the Q&A, and I'll relay them to you so you don't have to fight with the chat there to look them up. The first one we have is, if I'm in the middle of a gout flare, are there certain foods I should eat to help with the treatment plan?
Yeah, so once you're in a gout flare, definitely you need to be looking at, how do I treat this medically? So that's really, really important. Like I said, just eating some cherries, it's not going to be enough to get your numbers down where you need them to be. But you can support your body, especially during a flare, by really pushing the water and focusing on the fluid is probably the most important thing to do. And then I really would step into some of these like Mediterranean plant-based diets. Even in a flare is a perfect time to start changing your diet. It could help you over time prevent future flares.
Great. And the next question in our list was, what role does hydration play in gout management? So maybe there's a little more about that, or like the actual role that water plays?
I mean, water is actually helping flush the uric acid out. It's actually helping your kidneys do their job. And so if you think about it that way, it's absolutely critical. It can be helpful when you're in a flare, but it also can be helpful to prevent or lessen flares. So honestly, hydration all the time, if you've got a history of gout, is really critical.
Cool. How quickly do flares occur after ingesting the trigger foods?
Yeah, that's a really interesting question. It's going to be really different for each person. It depends on where your uric acid is starting. So if you're already really high and you're already on the edge of a flare, if you go out with your friends and drink like 3 beers, that really might be enough to sort of push you over and push you into a flare. But if I drink like a beer right now, does that mean I'm going to go into a gout flare? Probably not. It just kind of depends on where you're at, but it's not always food related either, right? It's how your body is processing and eliminating and how much is already building up in your joints. So it's really, really hard to say. Probably depends on you, your uric acid levels, and the type and quantity of food you're eating and how sensitive you are to them. There's a lot of factors.
Yeah, a lot of inputs. I hear you. Do low carb diets help or hurt gout?
Yeah, that's interesting too. I mean, if you look at the diets that have the most efficacy, Mediterranean, plant-based, DASH, those are not low carb diets, right? Those are actually carb moderate, whole food, whole grain diets. When you do low carb, so carbohydrates go down, the only thing that can go up is fat and protein. A lot of protein containing foods have purines. So to me, it seems much better to do the evidence-based plant-based, which is a little bit higher in carbs, but you're not going to have all those purines.
Yeah, I remember about a decade ago did Atkins, and my flares went up. Just,
Yep.
because I was eating a lot of meat and I was still taking my gout bath, but it just had adjusted all the inputs to where I had more attacks. I know you both mentioned cherry juice. I'm not sure if the question was answered in quite this way. Does black cherry juice help prevent attacks?
So there is a little bit of research that shows it can be helpful, right? And what I'm reading in the research is it's the specific antioxidants in cherries that could play a role. So I'm seeing both black cherry juice and tart cherry juice and actual cherries could be helpful. Will they be enough to cure gout? Probably not. Could they play a role in your overall healthy anti-gout diet? Yeah, I think so. And we all should be eating more fruit probably anyway.
I know I had to be careful about some cherry juice that somebody gifted me because it was super high in sugar. So
Right.
then that just affected my kidneys. It's like, it's got to be kind of the right kind of cherry juice, I guess. How about sugar substitutes like Crystal Light and stevia? Are they okay for gout?
Yeah, that's really interesting too. The main issue seems to be actual high levels of added sugar and high fructose corn syrup. So corn syrup. So the desserts, candies, baked goods, and especially sodas and coffee drinks, those are a real big problem. So by doing artificial sweeteners, you naturally step away from that, which could be positive. However, artificial sweeteners are an ultra processed food, right? They're moving us away from eating like a whole foods natural diet. So my advice as a dietitian is to start to learn how to be used to less sweet, right? It takes a while for our taste buds to adjust. The more you step away from it, the easier it will be. That's where I would go.
Cool. How about the best foods for general kidney health?
Mm. Yeah, it's interesting. Kidney health, you want to protect blood pressure, right? So it's interesting if that's your focus, the DASH diet is specifically designed to stop hypertension, and it shows up in gout management. So to look more at the DASH diet, it's just a whole foods kind of plant-based diet. It's got a lot of flexibility, but what you're looking for is a lot of plant foods. Vegetarian, vegan diets have amazing research for kidney health. And you also got to push that water. You need to protect your kidneys by drinking enough water, unless you have specific restrictions.
Thanks for that. This is the last one I got on our list, but then there may be, I see there's a few more coming in through Q&A, so I'll let other people chime in if they got them. Oh, I see some more down further in the chat. All right, so here we go with this one. Which diet would you say is best for gout overall? Mediterranean, DASH, paleo, plant-based? If you had to suggest one.
Ooh, if I had to suggest one, it's hard. It's hard because the three that have the best research have a lot of similarities. Probably the one that has the most research that shows up again and again is the Mediterranean diet pattern. But whether you do Mediterranean, DASH, or more of a plant-based vegetarian, all three of those are probably going to be really beneficial.
Okay. We've got someone in the audience who has a lot of food allergies. They only eat lamb and turkey, never consume alcohol, rarely soft drinks, love chocolate and dairy. And they say they will switch to low fat based on what they heard here. And they eat a lot of berries, allergic to soy nuts, peanuts, and fresh peaches, pears, some other, they can eat canned fruits. Only eat salmon once a week. Help! No, that was kind of a lot, but me.
Yeah, I mean, honestly, I work with a lot of people that have multiple food allergies and insensitivities. I mean, one thing just from looking at that list, I do think that switching to low-fat dairy would be a really good focus. I would also focus on hydration, but somebody that has this profile needs to be working with a dietitian that can help them. That's absolutely critical. So definitely reach out to someone like me or find another registered dietitian to really partner with you and just make sure that you have enough to eat, you're meeting your nutrient needs with all those restrictions.
Great, and I do want to say, hit up champagnenutrition.com to get some tips from her, from her, and then from Ginger, and then you can, get some more guidance here. How much does salt affect gout?
Yeah, the salt connection might have more to do with kidney health and blood pressure. And that's something that you really want to keep top of mind so that your kidneys are flushing out that uric acid. So water follows salt. So if you have a really high salt diet, that's one reason that you might have, more issues with blood pressure. So there are salt guidelines below 2,300 milligrams a day. I'd start there and then you work your way down, because ultimately the American Heart Association suggests 1,500 milligrams a day. So most people are looking at having a lower salt diet, and it might be easier than you realize if you've got the right support to do that.
Okay, I think I know the answer to this one. I'm going to let you definitely go at it. Shellfish, yes or no?
It's not a complete no, never, but they are high in purines. And so most people that are experiencing gout and really struggling with uric acid are going to need to be on a lower shellfish diet. It might not mean none, but it probably means less.
Great, thanks a lot for those answers. And I really learned a lot. I know our audience is grateful for you lending your time and expertise. And now all of us have a better grasp on how best to eat for gout manage our condition. I want to say again, champagnenutrition.com. We've got some resources on the Arthritis Foundation website, arthritis.org/veg meal plan. That's all one word. And there was that email I'd like to say once again. If you have further questions, you can send an email and somebody will get back to you. It's mandwele@arthritis.org. Do check out the website if you haven't yet, because if you just, there's a search box in the top, and if you just put in recipes, you're going to find some stuff in there, that a surprising amount of resources in there. So thanks again, Ginger. That was great. I really appreciate that presentation. All right, what's coming up next here? Okay, before we sign off for the night, we have a reminder. We'd like to remind you that the foundation has a lot of resources and events coming up to help you manage your arthritis, including a webinar, COVID and Arthritis Roundtable. That's in a week. Yeah, August 19th, same time, same place. This is going to be moderated by Dr. Natalie Azar, who is an NBC News medical contributor. Do not miss this one. Let's see, lower body joint pain solutions on September 1st, same time, same place. Panel of healthcare professionals representing pain management, physical therapy, occupational therapy, and orthopedics will discuss pain relief solutions for lower body joints, including the spine, low back, hips, knees, feet. You'll get, there will be Q&A as part of this session, so you can ask your questions. And fitness and arthritis, balance and therapeutic exercises on September 27th. Same bat time and bat channel. Don't forget to check out our Facebook Live event. That's this one, I guess, about importance of flexibility and balance, how to add functional movement into your fitness routine. You can register so that you'll be updated on events and webinars like this by visiting arthritis.org/webinars. We mentioned before the Insights program. Please take 10 minutes to fill this out, where you'll find the Insights assessment, and this can help lead to more effective care for adults with arthritis, develop programs that meet your community's needs, and shape a powerful agenda that fights for you. Visit arthritis.org/insights to take this assessment. It'll help all of us with the condition, any arthritis, and it'll help you too. I'd like to thank our sponsors for tonight, our partner, Horizon Therapeutics, for their support that made production of this webinar possible. And as a closing reminder, please note that in a couple of days, you should receive a survey asking about your experience. Please take the time to fill the survey out completely and honestly so we can improve these and best serve you in the future. Your feedback helps us to improve educational events, to help with your needs and wants. Thanks again for joining us tonight. Take care.